Hello.
Yep.
Okay, hi, it's February 5th, 2015,
Thank you.
and my name is
I know.
Sandra,
Pretty hard to get out. Especially since
with my husband,
arm is a little odd.
Lloyd,
Can we keep the noise down?
and the last name is Jacobs, and I have ALS. And I wanted to record this,
segment?
I want to record this video because I would like to tell you things about ALS that nobody wants to talk about or tell you. And the first thing I wanted to tell you, starting from the feet upward. When you have ALS, depending on how far advanced you are, eventually you'll find that your muscles in your legs will stop functioning and working in your feet. And what will happen is you need to get range of motion exercises daily where they will move your legs and they will move your toes back and forth, because if they don't, your toes will start curling downward and inward and will be very painful. So make sure you do this if you have ALS and your lower extremities are affected. Next, the other thing is when you have ALS, because it's a muscular disease, it affects everybody differently. So it could affect the upper part of the body before it affects the lower part of the body. But also when it comes to going to the washroom, the best thing for you to do is don't go in a diaper and try to maintain your dignity by going, if you're paralyzed like I am, by going in a sling with gravity where you're hanging so you can go to the washroom. If you're fortunate where you're not paralyzed from the waist down and you can still go, all the better, but if you can't, it's better to do it this way, because if you're sitting down and you're having a bowel movement, for women it can cause a lot of urinary tract infections because your bowel excrement has nowhere to go and it will travel from back to front. The next thing is when it comes to eating and chewing, if you're lucky, your throat muscles still work. One thing you've got to be aware of is it's very hard to ingest and digest both liquid and solid at the same time. And that is because, Lloyd?
There's two different sets of muscles. One distributes the moisture, the water, and everything else. The other takes the solids. And when you have ALS, it has trouble deciding which one goes. So you have to make sure you can't have like soups or stews or anything like that that's got liquid with it, because it doesn't recognize which one it is, and it can wind up choking you and everything else. So you always got to be aware of that, what you eat. You got to have what kind of consistency, and make sure whenever you do drink, you drink after you're done eating, so that way you don't choke and it doesn't go down the wrong way. You can't take a drink while you're eating at the same time, or you'll have the same problem.
That's right, and people don't tell you this. When you have ALS, you seem to find out the hard way. This is not something we're advised of ahead of time. So bear that in mind. You use two different muscle groups when you're drinking fluid and eating solid. And never do that at the same time. You always have to do it separately. When we're healthy, we take it for granted, but when we have ALS and our throat muscles are starting to become affected, you've got to try to reserve energy. Next is air. If you need to have, be prepared that if you have ALS, eventually your breathing's going to be affected. So make sure that you have this sipper. This is not something that's common. I was fortunate enough to get it from McMaster and the ALS ventilation pool. And without it, at this stage, as I'm getting later in the disease, I would be on a mask. So this is much easier. It's not oxygen, but it's just an apparatus that forces air into the diaphragm, that which enables me to talk clearer, stack air in order to cough and to sneeze. Again, it's something that's not common. Sunnybrook Hospital did not have this device, which is one of the largest ALS clinics in Canada. So I want to make everybody aware of that. By the way, this is being filmed or recorded in Canada. The next thing about ALS is they'll try to put you on a air mattress for sleeping. And I've spent about 9 months trying to find the most comfortable way to sleep, and I only got about 2 hours of sleep a day for a while. And what we discovered is, Lloyd, you want to tell them?
Discover what it is the best thing is an orthopedic mattress. Especially you can have the rising bed and the feet elevation and everything else. Because with ALS it's a muscular disease. And what you need is something to support the bone structure and everything else. And as a chiropractor told us, air mattresses aren't really supporting anything once your muscles are gone. So you need orthopedic mattresses to support the bone structure the best you can. And since we switched to that, we were getting a lot better sleeps, sleeping through the night and everything else. So the air mattresses, we were just we weren't getting solid sleeps, and it was just horrible. So the best thing to do is just either get a hospital bed with orthopedic mattress in it or whatever, but just the air mattresses just didn't work in this case anyway.
Yeah, so it may be different for everybody else, but we're just trying to give you some pointers. Because once you get ALS, sometimes people don't want to talk about their symptoms. And it's harder for you to figure out the hard way because you have to go through a lot of pain and endurance in the meantime. So again, air mattresses do not provide enough support for the muscles. It's better for burn victims, but again, you may find it different, but this has been my experience. The next thing that we'll deal with that I'm trying to think quickly off the top of my head is help in regards to services at home. Unless you're born with a silver spoon in your mouth and you can afford 24-hour care at home if you want to stay at home. And again, if you have ALS that's progressed to the point where you're paralyzed, I think the dog's trying to move me out of position.
No, we'll shut it off.
If you're paralyzed, what you need to do as you're slowly starting to lose the ability to walk and stuff is you need to have at home, what would you say? You need to have at home a ceiling lift.
You need a ceiling lift. You need a roll-in shower that accommodates a commode chair, with a tilt commode chair. And you need a lot of patience, basically, is what it is. You need a lot of wider doorways and everything else.
And you need, exactly, you need to have a commode that tilts. You need to have a bed, preferably a posturepedic one, that goes up and down. They wanted to put me in a hospital bed when I first got home, and I wanted to stay with my partner and still enjoy the togetherness of bed, so I got a one of those, I don't know what they're called.
Craftmatic?
Craftmatic bed. It's a double bed. And it goes up and down like a hospital bed, but two of you can sleep in it together. We put on rails on the side to provide a bit of support. So those are the things you need when you get home. Now the other thing is when you're dealing with the ALS clinic, as of the date of this video, the ALS clinic will provide equipment to